still morning. And like Paul, I don't have a slide about who I am. Take too many slides. So maybe we can get started. Oh, it's here. So it's as Amrik has said, it's an exploration, qualitative exploration. Basically what we wanted to know, a lot of you have talked about, are these the right indicators? So talking to normal Kenyans, typical Kenyans, we tried to ask them to describe a person who has good financial health versus someone who has poor financial health. And here, for Kiswahili, it is control. Yeah, it is who has good financial control versus who doesn't have financial control. Next slide. So we did 4 focus group, very modest number, and we had rural and urban. And when we say urban, we talked mainly in a informal settlement, because in this report you'll find that there's a lower 40% and the upper 20%, so we tried to keep to the same. So we had what we call urban poor. We did the groups in Mathare, and then we had Nairobi middle income. Middle income is very diverse, but for this particular one, we did the Buruburu, Donholm areas. And then we had rural poor. Rural poor we did in a rural area that had a lot of casual workers who came in to work in those farms and had rented little houses in the area. And then we had rural, middle, and they were gender specific. We first started off having mixed groups, and they didn't work. The men didn't speak at all. When we asked them, who do you think is doing poorly financially, they were totally silent, so we had to stop that and had gender-specific groups. So let's go on, the next slide. And part of the discussion involved using a ladder, and it's very similar to, I think, what Paul said about, this scale that comes from having trouble to doing great. So we try to figure out where are you now, and where are you heading, and what do you need to do to move to the next step. Same rationale of, coming from this extreme to going to the other extreme. Next slide. Okay, so this is, I don't know whether she's a typical rural middle income female. So she was unique. She's a farmer, and she has a little shop outside her farm. And she was very happy. She had just acquired a gas cooker, which is, I think it's a big achievement. So that's one of the profiles of the people we interviewed. Of course, this is a focus group discussion, so it would have about 8 to 10 people. So we'll go to the first domain, which is ability to manage day-to-day. Paul told you that we are at the descriptive stage. So you'll find that a lot of this has a lot of descriptions of what the actual verbatim that people use to describe. So when you ask them, tell me about someone who you think is struggling to manage their day-to-day, how would you see them in your community? And the focus was about thinking about people within your community. So you don't talk about the affluent people, but people who live in your community. And the obvious one, and the most weighty, I think a lot of people, Peter has talked about how do we weight this. And qualitative weighting is based on the spontaneousness with which people say it. As soon as you ask the question, they start talking about it, or the passion they talk about it. So it was about not having enough food. And we have someone who says, the kind of money I have, there's no way someone like me can actually provide all the meals in the household. Very closely associated with that is that the whole concept of, is my household getting quality as opposed to quantity? So you have someone there who says, because I feed them to fill them, but it is not the best. I would want to give them something different. Sometimes it's the same food throughout the year, but throughout the week, but at least they are full. Again, still same measure of food. And then there is the thing about living within your means. I think someone talked about that we have so much choice. We are constantly borrowing. So this is something they talked about, that you should really not live on credit for your day-to-day consistently. Of course, there is the times you can, but what they are saying that you cannot have someone who is constantly using credit for their day-to-day. For them, that's someone who is struggling. And then there is another one. Again, all this about assurances. Can you really cope with your day-to-day? I think Mercy talked about that when I wake up in the morning, I want to be assured that if something comes my way, I'm able to cope. So for them, that's another descriptor of someone who is able to cope with day-to-day. Again, it's probably a perception. Someone was talking, is it perception? How strongly should we use subjective perception narratives in terms of describing? So this woman says, it doesn't matter what happens. When I wake up, I know my day will be like in terms of feeding my family. When I wake up, I know at least I'll be able to provide 2 meals. So it's not based on lack. You don't wake up and you don't know how will I cope with today's expenses that come my way. So that assurance is quite important for them in terms of somebody who seems to be able to cope with their day-to-day. So remember, as we look at these indicators, we are looking at them in the context of what do we have currently, what can be included, but as Amrik said, we also have to remember we have historical data. So what does it do in terms of the data we've been tracking? But also, we want to ensure that when we are adding more indicators, they actually improve the index. I think there's something, okay, I don't know statistics so well, but there's something they said about being coefficient of 1, meaning it doesn't add additional value to the overall indicator. So other indicators we have is that day-to-day expenses is not exclusively or dependent on remittances. And this is that concept of vulnerability. I think someone also said, I think it's Mercy, I keep remembering Mercy, talked about, one person is employed and they are taking care of the bills of several people. And for this particular profile, they felt that vulnerability, that my day-to-day expenses is exclusively supported by remittances, makes them feel very vulnerable. And it is an indication of someone who is struggling to cope with their day-to-day. And a fantastic verbatim. This lady bought her mother a cow. So she says, now that I have bought her a cow, I think she's sorted in terms of her day-to-day because she doesn't have to keep calling me for money for food, for money to go to church, for money to give donations, just the small expenses, she's able to cope with them. And then a very unique one is that there's the ability to access and repay small value mobile lenders' loans. So what they're saying is, yes, we have challenges, but if you have the channels to be able to borrow very quickly and repay, then you're able to cope with your day-to-day expenses. And there's a fantastic, again, a really illustrative verbatim there. So this lady said, it was really helped me M-Pesa. Even when I am down, I can always get a quick loan from M-Shwari to give me a small boost. It was very helpful because even when there was COVID, my family never lacked. If I did not have enough money, I would just borrow from M-Shwari, KCB, M-Pesa, or even Fuliza, and we would be okay. So she's able to cope with her day-to-day because she has that channel open to her. But the main thing is here that she's able to pay without straining subsequently. Another indicator for managing day-to-day was someone who is able to hold some savings in a very easily accessible channel, meaning that if I need the money immediately, I can get it. And I think, there's a story about a woman who was married, she's no longer married, and she had no cash with her, but now she's doing activities that ensures at any one time she has some cash that she can access. It could be on M-Pesa, it could be liquid cash as well. And then the final measure for them was someone who has a budget and keeps to it. They struggled to find among themselves who does it, but they kept on describing this person in their community who everything is clearly written out, they've got a tight schedule, and they keep to it. So those are the indicators they used to describe someone who is coping day to day. Then we can go to the next domain, is the ability to cope with risk. So maybe I can just introduce this young guy. So this is what we had as one of our respondents for the low income. He's employed, he's a boda driver, his wife washes clothes in the neighborhood. It's casual employment, so sometimes his income in Nairobi dips to below 15, which is challenging because he has 3 children. So yeah, that gives you an idea of some of the participants who were in these groups. So in terms of ability to cope with risk, one of the most weighty ones, the one that they thought was very critical, is that you should have your own cash. Meaning, can you have some cash to cope with that unexpected expenses? Not from borrowing, not from your relatives, but you have had cash that you can fall on. And then I think we've talked a bit about livestock. People have said, should it be weighted differently depending on your geography? There was also the issue of, you have livestock that you keep for quick emergency. That was an indicator of someone who's able to cope with risks. And one of the verbatims we had was very interesting. As you know, schools, before we had our elections, schools were closed suddenly. And one mother said, what actually saved me, she said, what I did is I got money from the things we do in the village. And we are like, which things do people do in the village? And she said, I sold a chicken. And the next day, she was able to send her son fare because she didn't have bus fare to come home. And then there was the ability to borrow quick loans beyond the amount held in saving. I think someone talked about getting total value from your savings. So those you're saying, I'm holding my savings, but can I get slightly more? Because an emergency, in many cases, people felt that it's something that goes beyond what you have. So can you be able, I don't know, I'm just talking. Okay, yeah, so it's whether you're able to go beyond what you have. And that's why maybe someone says that, you should bank or you should have a financial provider that actually meets you in the middle, makes your money works for you. And then, of course, having multiple sources for immediate emergency loan was critical. There's this guy who had an emergency, and he got the money from the M-Pesa agent. The M-Pesa agent, by the way, in some of these villages is a great resource because he always has float, and he can lend you, and you can return before the end of the day, isn't it? So for him, once he's gone there once, you can't go back next week. So that you need to have multiple channels. Even if you repay, you shouldn't make it a habit to borrow. Of course, that doesn't reflect our relatives, yeah? Okay, let's continue to the next one. So other measures or indicators that they used is that you have an asset that can be used as collateral. And collateral here, people talked of land, they talked of cars, something that the bank, again, can use to be able to give you the cash needed. That's quite important. And then another indicator, remember this is general population. They're using layman's language. They're not using financial inclusion language. So we're just using the same verbatims they use. So for them, another indicator is someone who does not see donations as the main source for funding emergencies. I know our social networks is critical in terms of sorting out house when we have an emergency, but for the respondents, they didn't feel that is the ideal option. It's inevitable that that's what happens, that you borrow your relatives. And there's a verbatim there. And she says, to me, to get donations is really not a good coping, yeah? She got donations to sort out her mother's bill because she felt that she should have done better. I do not want to involve people in these kinds of things because they help you and then they mock you later. But now I am prepared. And she went out subsequently and got NHIF for her mother. So that's something else that you need to do. And then there was the issue about not selling under duress or not selling an asset that was not intended for sale. And I think that's going to be tricky because I think a lot of us have talked about livestock. I think Amrik talked about livestock. Irene talked about how do we weight livestock. In some areas it's not, it's not really an asset for sale. And here it was very clear that when you sell something under duress, then you're not coping well. And here is a scenario of somebody whose brother fell ill, they had hospital bills, and they had burial bills, and they sold the family land. And they talk about the conflicts that happened as a result of that. And they thought that maybe it would have been easier if you had a cow as opposed to selling the family land, because then that, of course, has an issue on their livelihood. And then the last indicator was copes with a child's health emergency. And yet this is very similar to what we had in terms of, I think we have an indicator that talks about has not gone with medical in the last 12 months. But here they were very specific that a child's medical issue is more urgent than any other medical emergency. So if you're not able, if you're going to delay, you can delay an adult's medical issue, but they didn't think you can ever delay a child's medical issue. So for them in their community, people who, I have a sick child, I wait for 3 days because I'm looking for money, for them that's a person who is not able to cope with risks. Okay. Oh, we are still at it. Okay, and then another indicator, which I don't think it's currently captured, is that has insurance. Having insurance, of course, helps you cope. But also, there's the option of getting emergency loans. We have financial providers that have emergency loans. We have SACCOs, we have Chamas, I think we have some MFI. And this person says that, okay, she was talking about wealthier people. They say they are able to cope with these shocks because most of them have insurance for their cars, their houses, their body parts. She used the word body parts, but I imagine she means health. And some even take covers for their dogs. I don't think it happens in Kenya, but I think the suggestion here was that with good insurance, you're covered for all eventualities. And then, of course, you can have a SACCO that can give you an emergency loan, especially if you have, your income is coming through the same channel. So for them, those are people who are able to cope. Then we have another unique indicator is if your inability to cope with risks is that you're unable to participate in social functions that are obligatory. So for example, we had this scenario of someone whose brother lost their child, and they didn't go because they didn't have fare. They did send money, but they still felt that that was really not the right thing to do, because in essence, he says that I felt very bad. I couldn't, it made me feel really bad that I couldn't be there when he needed me. This is not how to deal with an emergency. So yes, he sent the cash, but his physical presence, he felt was more critical. So for him, he felt that he is not coping very well with risks, because that little money, he was not able to raise it. And then, I think a very powerful one is ability to survive X months after loss of their main livelihood. If you're able, your job ends, or whatever your main livelihood or your business collapses, and 6 months down the line, you're still able to pay your bills, they thought that's somebody who is able to cope very well with the with their risks. And they give an example. This lady gives an example of herself. She lost her job after COVID. She was able to survive for 6 months. And she was able to do the basics. She was able to pay the bills, especially food, rent. Her kids were actually in boarding school, but she was able to tackle all those expenses. Okay. Any questions? Okay, we'll do them at the end. So, okay, so this is another break. This is the respondents we called rural, low income, tended to rent these houses that are built in this, we were in central Kenya, where they build these rentals, very basic rentals, where you come and you pay some money and you can, you can farm in the neighborhood. Yeah, so that just gives you a scenario of one of the houses. And this was a male worker. He was casual. His wife was also casual. So both of them wake up every morning and go look for work, mainly farm-based work. So we go to the last domain, ability to invest in the future. So one of the most, a lot of people, when they think of the future, they were thinking of they are no longer working. It doesn't matter if it's 60, it's 40, it's 30, whatever it is. They assume that they are no longer able to fend for themselves. That's what a lot of them thought the future would be. And the most ideal is to get a lump sum. I guess that's what we call here pension, yeah? And there's this, in this group, this lady talks about this friend who is likely to get $500,000, and it's a rural group when she stops working, and that sounded very attractive to everybody else, and people started asking, oh, what's the name of the employer? Can I get a job there, And then has used employment income to save and invest in business, and has the confidence in her ability to retire. You have those papers, so as you can read the verbatims, because some of them are pretty lengthy. So here is someone who is investing their current earning in assets that are going to yield in future. But here we have the issue of confidence. In this conversation, she's confident that if I stop working in the next X, we will still continue with the current lifestyle that we have, or we'll be able to continue paying the bills we have. So it's got two aspects to it, is that I am investing in the future, and I have the confidence that actually I'll be able to sustain myself in that future. So it's a long story about someone who worked in KQ, then they went to an NGO, and she's telling her friends right now she has rentals, she has opened a business, and if she stopped working, all will be well. Yeah? So another key indicator, I think, for ability to invest in the future is that you should not be on a CRB rating, because that shows really, you're unable to cope with your debt. So here we have someone who says, for me, for sure, any long-term thing is not going to work, because there's no chances of me getting a large loan are negligible, because I am on the CRB rating. Again, there was the saving in kind for long-term goals, and these are people who, there were scenarios where people say, when my child went into Form 1, I bought a bull, or I bought a cow. And the plan is, hopefully, if she makes it to college, I will be able to dispose it and maybe pay for the first few months as they sort out help or something like that. So that's saving in kind, yeah? And a lot of people talk about saving in kind to a very specific goal. I am keeping this cow because I think in a few years' time, my child will be joining Form 1. Yeah? That was it was very linked a lot to education, because that's where you know that day you have an end goal, and you know on 1st of 2029, this is going to happen. And then, of course, currently accumulating savings in assets that appreciate. That's quite obvious. Anyone who is, putting money in land that can be sold, not ancestral land. There are buildings, there's rentals, there are plots for rent. They're also investing, despite being rural groups, guys actually know there are things called bonds and shares, and also SACCO shares. So investing in these items that appreciate over time was perceived as an indication of someone who is investing in their future. And then very similar to what we had in terms of coping with risks is saving with a product where the loan amount available grows by X. I think someone said, I think I wrote it down somewhere, about you need to be in assets that actually reap value from the channel used. So they're saying, hey, you need to be able to have a product that allows you to get that loan amount, a larger loan amount than you required. And here is a woman, she's rural, she's poor, but her husband was able to get, she's not, okay, I think she's middle, sorry about that. Her husband was able to get 1.5 million, yet the account had much less. So for her, that is truly, you are using a channel that actually is going to contribute to your well-being in future. Then, of course, saving in more illiquid tools, lock accounts that are very difficult to access cash. For them, that's an indication of someone who is saving for the future. And then very critical is regular savings from income. And I have discovered these people who are looking out for their future are people who are able to save more and spend very little compared to what they receive every time they receive. So basically, is every cycle of income, some money exits and goes to this long-term goal. Not that, oh, I saved the month that there's a little bit more. So they are consistent. Doesn't matter if I get less, there's always an amount that has to go into my savings account or my savings, wherever it is. So that's it in terms of the 3 domains. This was who? That's Nairobi, income, middle, male, household size. Typically, a lot of them are hustlers. They are employed, they have a business. This guy makes a uniform for watchmen. At the same time, he's employed as a school bazaar. So they have multiple incomes, and so that's just a picture of some of the respondents who would be part of the discussion, just to give you an idea when we mean middle income, what it is. So I think someone else talked, Paul did talk about the determinants of financial health, that we need to differentiate, to know that there's determinants and there's outcomes. We had the similar determinants, which we're calling drivers, featuring as what really impacts on the financial health outcomes. And these particular drivers cut across the 3 domains. So education or training is critical. Having multiple income channels is also a key driver in terms of your financial health. A lot of the groups talked of access to inheritance. I mean, if you get some lump sum inheritance or assets that are already operational, that really contributes is a driver in terms of your financial health. Specific exposure to financial education, and I think we saw that a lot of people are getting information from peers and friends and not necessarily from financial providers. And then has regular inflows is very critical, meaning that every month or every week or every day, I know this kind of amount is going to come. It is one of the drivers for financial health. And then, of course, support from spouse. You can call them spouse. You can call them, I guess, your social network as well is one of the drivers for financial health. Okay. So I think this just shows you, overall, what role does each of the financial providers play in terms of that financial health. So you see, like, for example, in managing day-to-day, they rated mobile money fairly highly, and including M-Pesa. When it comes to coping with emergency, they talked more of mobile lending and chamas as well. despite saying that, SACCOs and MFI have emergency products, I think here they're thinking about ease of access, because even though your SACCO has an emergency product, you still have to apply and maybe wait 1 or 2 days. Whereas in the Chama, they say you just call the chair lady. She's always a chair lady anyway, the chairperson, and then, immediately the money is transferred to you. And then in terms of investing in the future, they talked about M-Pesa actually investing in the future. And the context here is that M-Pesa allows you to link back to your bank. So the fact that you can transfer, because a lot of them receive payments on M-Pesa, the fact that you can transfer from your M-Pesa to your locked account as cooperative or a bank, that was a positive. The bank also, anything that is difficult to access, the bank was also perceived as ideal in terms of investing in the future. The SACCO, of course, we had about, you'll get X amount beyond what you have saved. And the Chama also came in investing in the future because apparently Chamas were critical in very small loans. Like, I need to do my business. So they are helping me in that future goal of me becoming more independent. So the final thing here is trends. I think we have seen consistently, a lot of the speakers have said, yes, financial health is deteriorating despite the fact that financial inclusion has almost plateaued as 80-something plus. So in this, we try to understand where are you now and where were you in 2019, just to see that trend and what really happened. And we won't spend too much time on this one. Next slide, please. But, a quick count from the groups, and it just basically validates what Amrik has shown, is that the trend really is a lot more people indicate that it's declining. And if you look at why it's declining, the biggest thing is loss of jobs. I mean, COVID impact is still with us today. But also, when you move from employed to casual, remember you're not able to do, remember, I think Cheronga talked about financial health is about planning, saving, managing your debt, and budgeting, something like that. So when you move to a very irregular income flow, it affects all those variables. So anybody who moved from employed to casual, anybody who moved from business to casual, it becomes a big issue. And I think I have one or two, a verbatim here that is very interesting. So there's this young man, he says, in 2019, I had a stable income, and more than anything else, I did not have idle time. My business was working for me. Then COVID came. We parted ways with my partner. We couldn't agree, and the business ended. So what then happens? I'm now, first and foremost, I have to depend on casual jobs, but more than anything else, I have too much idle time, and half the time I'm on loan apps borrowing. So my things have really deteriorated for me. So that's a very common trend. Then we have debt. I mean, that tells you about this person. Debt has been critical in terms of deteriorating his financial health because he's borrowed with, he has 5 different lines, borrowed 5 different people, blocked 5 different lines, So he's, complicated life, I must say. And then loss of a spouse, I mean, that's obvious. And actually, for the lady who experienced loss of a spouse, it was the biggest drop ever because, it's not only income drops, she started and has to take on this role, but suddenly she doesn't have this social support that came with her husband. So she had a huge drop when she lost her spouse because she comes from step 6 and drops down to step 2. Okay. And just see, she takes time to get back into the rhythm, to start earning. So it was a very, very drastic drop for her. And then, of course, there's the increased expenses. One of the biggest increased expenses is when children transit from primary to secondary, from secondary to university. That huge expense, for a lot of people, says is what contributed to a drop in their financial health. And then in terms of, we have a few people, and you can see from that little table there, remember these are not quant figures, it's just indicatively. We have a few people in the middle groups who've said things have improved. And a lot of them have also to do with lifestyle. I mean, life stage. So your kids are no longer going to school. You had a child in university, and the child got a job. And now she's taken on some of those responsibilities. Yeah? Or you have a child, yes, or you're no longer paying as much school fees as you are paying. And some of these people have taken drastic changes. Some of them opted. As you know, in the village, the most famous school is called Academia. Yeah? So a lot of them decided to remove the kids from the academies and took them to public schools. So that helped them in terms of, reducing some of those expenses. I think that would be all. Thank you.